كيف حالك يا طيف؟
الحمد لله بخير. انت شو اخبارك دكتور؟
خير الحمد لله. كيف امورك؟ تمام؟
الحمد لله.
وين باقي زملائك؟
قاعدين يدخلون.
وين اهلك؟
معاي ابوي موجود.
اهلا وسهلا فيه.
هين.
سيد حميد
ايه.
اهلا وسهلا فيه. في حدا غيرك اليوم يا طيف ولا بس انت؟
بس انا.
اخترتي احسن توقيت.
ليش؟
خلاص هي الكل بيحتفل معك بالعيد هلا بالسيمينار تبعك.
ان شاء الله.
يلا كل عام وانتم بخير جميعا ان شاء الله.
انت بخير دكتور. أبلش؟
يعني استني شوي صغيرة.
تمام.
طبعا احنا لزملاء طيف الكل سيمينار بده يكون فاتح شاشة الكاميرا تبعته او الكاميرا. اوكي. طيب بداية بحب أرحب بالجميع وأهلا وسهلا فيكم، وبنحكي لكم كل عام وأنتم بخير إن شاء الله بمناسبة حلول عيد الفطر السعيد إن شاء الله تعالى، وبتمنى لكم إنه إنه كنا جميعا إن شاء الله من المقبولين بصيام رمضان إن شاء الله تعالى. وبرحب كمان بالسيد حميد والد زميلتنا طيف اللي هو معنا من البحرين. مظبوط؟ وأهلا وسهلا في الجميع. واليوم زميلتنا راح تفتتح معنا سلسلة السيمينارات اللي هي إن شاء الله راح تنعكس علينا بالفائدة، لأنه بتوقع من الجميع أنه الكل راح يستفيد، لأنه أكيد راح نأخذ معلومات جديدة ونعمل ريفرش للمعلومات اللي هي موجودة عندنا. تفضلي يا طيف.
تمام، لحظة بس دكتور. Good morning everyone and Ramadan Kareem. Thank you for coming today. I'm Taif Hameed and I'm looking forward to talking with you today about the role of diet in the treatment of polycystic ovarian syndrome. I will start my seminar with a question. Did you know that there is a high incidence of polycystic ovarian syndrome in the Middle East, mainly due to hereditary, ethnic, and lifestyle? Up to 20 to 30% of women in the GCC suffer from polycystic ovarian syndrome. Today, I will cover an overview about polycystic ovarian syndrome, symptoms and causes of polycystic ovarian syndrome, insulin resistance related to polycystic ovarian syndrome, dietary management and diet plans for polycystic ovarian syndrome. If you have any questions, please don't hesitate to interrupt me. I'm happy to answer any questions as we go along. Polycystic. Poly stands for many or multiple. Cyst. A cyst is a sac-like pocket of membranous tissues that contain a fluid, air, or other substances. Egg stands for pertaining to. This is the definition of polycystic ovarian syndrome, and I will simplify it shortly. Polycystic ovarian syndrome is the most endocrinological disorder in the reproductive age women worldwide. Endocrinological means a disorder. It's an issue with hormone production or function. It leads to infertility, insulin resistance, obesity, cardiovascular disease, and other health issues. This syndrome also increases the risk of type 2 diabetes, hypertension, lipid disorders, and malignancies such as breast and endometrial cancer. Now, I will cover some of the main symptoms of polycystic ovarian syndrome, such as mood swings, infertility, irregular menses, cysts in ovaries, hirsutism, trouble losing weight, insulin resistance, and level of androgens. These are the most important symptoms, and we will discuss some of these symptoms as we go along with the presentation. Now, we're going to mention the main causes of polycystic ovarian syndrome, which are excess of insulin, which is the most important one of them, hormonal imbalance, hereditary, high levels of luteinizing hormone, and low grade of inflammation. When we have excess of insulin, uh, it's called insulin resistance. When body can't use insulin correctly, pancreas produce more insulin to compensate the rise of blood sugar. Insulin resistance can lead to type 2 diabetes. Hormonal imbalance. Some causes of hormonal imbalance are chronic stress, type 1 and 2 diabetes, hyper and hypoglycemia, under and overactive thyroid. Levels of luteinizing hormone. Some causes of irregular or high levels of luteinizing hormone are chemotherapy, radiation, infection, alcohol, and issues in the pituitary gland. Those are the main causes of polycystic ovarian syndrome. First one is insulin resistance, which is caused by lack of activity, hereditary, and obesity. The second cause is androgen excess. It's caused by elevated gonadotropin level. Gonadotropin level causes the pituitary gland in the brain to secrete luteinizing hormone and follicle stimulating hormone. This hormone causes the ovaries to make estrogen and progesterone. It's also caused by elevated levels of LH, which is the luteinizing hormone. Luteinizing hormone causes the egg to release from the ovary, which is called ovulation. And it's also caused by decreased follicle stimulating hormone. Follicle stimulating hormone, it stimulates the ovarian follicle, causing an egg to grow. The third cause is anovulation, which is caused by decreased follicular activity. Polycystic ovaries, which is caused by impaired ovarian syndrome, hirsutism, and acne. Now I'm going to talk more about insulin resistance. Insulin is a hormone produced by the pancreas to use the sugar, glucose, present in the blood. If cells become resistant to the action of insulin or if body does not produce enough insulin, blood sugar levels can rise. To balance this, body produces more of insulin to keep the blood sugar levels normal. So as a result, we will have high levels of glucose and high levels of insulin, which will cause insulin resistance. Androgens. Some of the cysts produce androgens, which result in the viralization or the expression of male-like characters in the females. Visible signs of hyperandrogenism, which are high levels of androgen, include weight gain, abdominal and subcutaneous fat, hirsutism, male pattern alopecia, which is hair loss, clitoromegaly, known as enlargement of clitoris, deep voice seborrhea, or oily skin, and acne. Anovulation causes. Causes of anovulations are hyperprolactinemia, hypo and hypergonadotropic hypogonadism, and polycystic ovaries. Let's start with hyperprolactinemia. Hyperprolactinemia means excess of prolactin. Excess of prolactin can cause the production of breast milk in men and women who are not pregnant or breastfeeding. In women, too much of prolactin can cause menstrual problems and infertility. Hypogonadotropic hydrogonadism, or it's a secondary hypogonadism, is defined as a clinical syndrome that results from gonadal failure due to abnormal pituitary gonadotropin levels, and it may either result from absence or inadequate hypothalamic gonadotropin releasing hormone secretion or failure of pituitary gonadotropin secretion. Moving to the hypergonadotropic hypogonadism, which is also known as the primary or peripheral gonadal hypogonadism, and it's a condition where it's characterized by the hypogonadism due to an impaired response of the gonads to the gonadotropin and follicle stimulating hormone, the FSH, and luteinizing hormone, the LH. Moving to the most important one, polycystic ovaries. Most prevalent endocrinological pathology in the woman and most frequent cause of anovulation. Women with polycystic ovaries may exhibit a wide range of clinical symptoms and signs. However, an ovulation and hypergonadism are considered prerequisite in this pathology. Some of the most common causes are obesity. Approximately 60 to 40% of polycystic ovarian syndrome patients causes due to overweight or obese. Increase in visceral adipose tissue and central obesity even in lean women with polycystic ovarian syndrome compared to the healthy control group. Obesity may increase the risk of certain polycystic ovarian syndrome features, such as increased levels of androgens, hirsutism, infertility, and pregnancy complications such as preeclampsia and gestational diabetes. For your information, some women with polycystic ovarian syndrome can get pregnant, but they will have many complications during their pregnancy. Other cause is weight loss. Weight loss or lack or slow rate of weight loss in spite of a low-calorie diet. Levels of ghrelin and cholecytokinin are hormones which play essential roles in regulating appetite. Overweight women with polycystic ovarian syndrome increase hunger after eating a balanced meal, was observed before and after weight loss. So they collected a group of overweight women who experienced polycystic ovarian syndrome and they observed them before and after weight loss, and they saw that they experienced increased hunger even after eating a balanced meal. The success in weight loss, this means that if some women are overweight and we're trying to reduce their weight, we use this strategy. It is obtained through reducing calorie intake by 500 or 1000 kilocalories per day with regular physical activity as well as stress-reducing behavioral and physiological therapy and social support. The macronutrient composition of weight loss diets. Limiting energy intake dependent of weight loss led to improve in reproductive parameters. Low-calorie diet resulted in significant weight loss and improvement in metabolic and reproductive disorders. This means when we follow a low-calorie diet, we will experience, or the polycystic ovarian syndrome patients will experience improvement in metabolic and reproductive disorders. But high-protein diets were found to be more effective compared to high-carbohydrate diets. Increased intake of fruits, vegetables, and whole grains have protective effects against cardiovascular disease, diabetes, and cancer, as well as healthy individuals. It's not all about polycystic ovarian syndrome. High intake of protein from animal sources increase the risk of malignancies. Now, I'm going to relate the glycemic index and the relationship between them with the polycystic ovarian syndrome. Benefits of diets with a low glycemic index are diets can improve this diet, the low glycemic index can improve insulin resistance. A low glycemic index diet is associated with reduced risk of cardiovascular disease, type 2 diabetes, insulin resistance, and metabolic syndrome, endometrial, breast, and ovarian cancers. Therefore, it seems that the type of carbohydrate intake has a more important role in maintaining metabolic health rather than the total amount received. Moving to the fatty acids, yes, it is important. The fatty acids are important in polycystic ovarian syndrome. Diets high in fat, especially saturated fat and trans fats, mainly reduce insulin sensitivity and increase the risk of type 2 diabetes, metabolic syndrome, and cardiovascular disease. While receiving Foods containing unsaturated fats reduces the risk of chronic disease. As a result, or in conclusion of this slide, what's meant of it is to consume more of unsaturated fats and less of saturated and trans fatty acids. The relationship between vitamin D deficiency and polycystic ovarian syndrome. The mechanism behind this effect is still unknown, but a possible role of ovarian dysfunction in the mechanism that regulates apoptosis has been reported. Several studies have reported low levels of vitamin D in polycystic ovarian syndrome. Therefore, supplementation with vitamin D may be effective in modifying hormones and metabolisms in these patients. Now, this is the most important part of my seminar, which is dietary treatment of polycystic ovarian syndrome. Medical nutrition, therapy, long-term goals. Our long-term goals for our polycystic ovarian syndrome patients is to reduce body weight if overweight, maintain weight loss after weight reduction, engage in 30 minutes or more of moderate intensity activity, obtain knowledge and skills to support behavior changes, resolve metabolic syndrome, reduce the risk factors of type 2 diabetes mellitus and cardiovascular disease, and improve infertility. I will start with the protein and the polycystic ovarian syndrome. High proteins diet reported greater weight loss with high protein intake and greater reduction in body fat. Higher protein diets may result in several positive health outcomes, including lean mass preservation during weight loss and maintenance, better glycemic control, and amelioration of other cardiovascular disease risk factors such as blood pressure. We're going to talk about blood pressure and which diet to use if a patient is experiencing polycystic ovarian syndrome shortly. It is not clear yet whether these effects are due to the higher protein or lower carbohydrate intake, and no recommendation can be made currently about the dietary protein and polycystic ovarian syndrome. Addition of 7 to 15 grams of dietary protein in meals and snacks may offer some additional health benefits for women with polycystic ovarian syndrome, but this still needs to be confirmed. Moving to the dietary fat and polycystic ovarian syndrome, we discussed it previously, but using a diet with fat or what type of fats is important for polycystic ovarian syndrome patients. Moderately low carbohydrate as 43% of the diet, high unsaturated fatty acids, as we mentioned earlier, which meant by monounsaturated fatty acids, the MUFA, by 18%, polyunsaturated fatty acids, the PUFA, by 17% of the diet, led to a greater decrease in fasting insulin concentration and the acute insulin to glucose response compared to the controlled diet. We talked about protein, dietary protein, and dietary fat related to polycystic ovarian syndrome. Now we're going to discuss about low glycemic index diet for polycystic ovarian syndrome patients. Low glycemic index versus the conventional diet. They used 50% of carbohydrate, 23% of protein, and 27% of fat. This study was on 96 overweight or obese women with polycystic ovarian syndrome, and the study was over a year. The results came out as the following. Low glycemic index had better menstrual regularity, 95% for the low glycemic index diet and 63% on the conventional diet, which led to a better insulin sensitivity. Those with high insulin levels had a twofold reduction in body fat, modest weight loss, versus the conventional diet. As a conclusion, following a low glycemic index diet for polycystic ovarian syndrome patients is more effective than following a conventional diet. DASH diet for polycystic ovarian syndrome. It was used on a randomized controlled trial on 48 women with polycystic ovarian syndrome throughout 8 weeks duration. DASH and control diet consisted of 52% of carbohydrates, 18% of proteins, and 30% of total fats. The results came out as the following. DASH diet significantly reduces insulin, CRP levels, which are the C-creative protein, reductions in waist and hip circumference measurements. Exercise and insulin resistance. Exercise enhances muscle absorption of glucose by increasing intracellular glucose transport, GLUT4, protein production, which increased cellular glucose uptake. Exercise helps increase muscle mass and quell inflammation. DPP, which is a National Diabetes Prevention Program, it is an intensive lifestyle intervention, decreased both sedentary and television watching time compared to metformin or placebo. Metformin undergoes a glucophage. It's a medication used for type 2 diabetes mellitus. Also, exercise helps in stress management. Reaching to my take-home message or my conclusion of this seminar, polycystic ovarian syndrome is a most prevalent endocrinopathy. It is suggestive of a chain of pathological and hormonal reactions. Sedentary lifestyles, pollution, and excessive intake of junk food may lead to polycystic ovarian syndrome, hyperinsulinemia, obesity, dyslipidemia, hypertriglyceridemia, hypertension, and atherosclerosis. Increased risk of development of type 2 diabetes and cardiovascular disease. As a nutritionist, I would recommend for polycystic ovarian syndrome regarding to carbohydrate intake to consume it throughout the day, mostly during the lunch period of the day, more than the breakfast time or the dinner time. It has been observed that consuming the carbohydrate during the lunch time, not breakfast or dinner, has led to lower glycemic index and lower spikes in the glycemic index, which led to better insulin resistance. Thank you for joining me today. It is a pleasure for me. I hope I satisfied your curiosity, and I would be happy to answer any questions. Thank you. هلا دكتور.
كيف حالك؟
الحمد لله بخير، انت شو اخبارك؟
الحمد لله يعطيك العافية يا طيف.
الله يعافيك.
أبدعتي.
شكرا.
أي سؤال من زملائنا؟ أي سؤال؟
لا تستحون عادي اسألوا.
اسألوا. طيب. أول شيء بحب أشكرك على المعلومات القيمة اللي أعطيتينا إياها اليوم. بالنسبة لي أنا بشتغل في مجال الفود، بس كنيوتريشنست هاي كلها معلومات جديدة إلي، لأنه مش متعمق في الموضوع النيوتريشن، فبالعكس هي فائدة. وهذا اللي بحكيه إنه من فائدة السيمينار إنه دائما نتعرف على معلومات جديدة. أنا عندي سؤال، إنه أنت وين موجودة هلا، في البحرين ولا في الأردن؟
في البحرين.
طيب قديش نسبة انتشار هذا البوليسيستيك اوفرز عندكم؟
في البحرين؟
هل موجودة كبيرة، نسبتها كبيرة؟
إيه، في بداية السلايد حتى I mentioned it إن it's 20 to 40% in the GCC has polycystic ovarian syndrome. 20 to 40%, yes.
طب يعني نسبة كويسة. ايش السبب الرئيسي بتعتقدي فيها؟
لايف ستايل.
اللايف ستايل، لانه انت حكيتي انه جزء من المعالجه هذا انه نعمل مثلا اوبتين نولج وبيهيفير تشينجز يعني بشكل كويس. هل بتعتقدي انه هذا الشيء صعب نحصله ولا بسهوله؟
إن شنو اللي نحصله دكتور عفوا؟
انه البيهيفير تشينج، لانه يمكن مرتبط اكثر شيء انه هاي النسبه المرتفعه اللي بنقدر نحكيها نربطها في الاوبيسيتي.
مم.
ممكن يعني توافقين الراي؟ يعني قديش نسبه انتشار الاوبيسيتي في مثلا مع هاي الجي سي سي؟
كبيرة، شريحة كبيرة.
ممكن هذا السبب الرئيسي في يعني، او مش احد الاسباب اللي بتساهم
yes
بالبوليسيستيك اوفريز. طيب
yes
كيف بدك تقنع هاي المجموعه من الناس انه تغير البيهيفير تشينج تبعها؟
أول شيء راح أشرح لهم عن الكيس مالهم، إن شنو خطورته عليهم. أكثر الناس اللي راح يكتشفون إن عندهم polycystic ovarian syndrome they're trying to conceive or get pregnant، فهم أكيد
اه
يعني يبون يوصلون لهاي الريزلت أو الجول،
اه
فعشان يوصلون له هم مضطرين إنهم يسمعوني عشان يوصلون لهاي الشيء. فبدوري كأخصائية تغذية راح أشرح لهم شنو ممكن يسوون، شنو الأشياء اللي ممكن تساعدهم عشان تقلل من البوليسيستيك أوفريان سيندروم، وراح أساعدهم خلال هاي المرحلة كلها لما تقل النسبة they try and can conceive with less complications.
ممكن استخدام السوشيال ميديا وانه نوصل لمرحله انه prevention rather than treatment يعني.
هي عشان نزيد الوعي عشان أكبر شريحة حتى حق اللي يعرف واللي ما يعرف.
وهذا الدور اللي بنعول عليه فيكم ان شاء الله تعالى.
إن شاء الله.
يعني هاي اهم شيء ان شاء الله انه تقدروا تسووا فيها البيهيفير تشينجز. طيب عندي سؤال، انه حكيتي هاي بروتين دايت
إيه.
وانه انكريس من 7 ل 15 جرامز، وحكينا احنا بدنا نعمل كوميونيكيشن مع الجمهور، مع الناس الاشخاص الاوبيس. بدي هيك تحكي لي اياه في مقادير من حياتنا الطبيعيه، مثلا كل هالقد كل هالقد، مش انه يعني انا تيجي تحكي لي 7 جرام بروتين مع اني باخذ 7 جرام لحمه في اليوم بس.
لا، نزيد على البرسنتج اللي هم راح ياخذونه أساساً. يعني إحنا
يعني كيف
already.
السبعة جرام، 7 جرام ولا 10 جرام، هيك اعطيني اياها هيك في مقادير معينه من الاغذيه.
مم.
يعني انت بتحكي مثلا، بتحكي مع ناس نحكي بيفهموش من شغله نحكي 7 جرام و10 جرام بدي وزن. هل اكل مثلا قطعه مثلا حجم
مثلاً
200 جرام من
جريك
الميت؟
يوغرت.
اه
جريك يوغرت ممكن كمية عالية من البروتين موجودة فيه، يقدرون إنه ياخذونه كسناك مثلاً.
ايوه زي هيك، يعني ممكن نيجي نحكي لهم بشغلات انه، لانه دائما لما نحكي بروتين مثلا ممكن نحكي لحوم مظبوط، بس
صح.
ممكن في عندي مصادر
plant based.
اخرى غير اللحوم فيها ايش، مثلا عندي مصادر اخرى فيها بروتين بشكل كويس.
الألبان والأجبان
وايش كمان؟
والبقوليات.
بقوليات. فمثلا
العدس.
عندنا فعندنا different range موجوده، مثلا تكون موجوده فيها different type of foods
بروتينز.
فيها rich in protein. وبتتوقع يعني ممكن ان شاء الله يوم من الايام انه نوصل انه نقدر نحصل الوعي هذا عند الجمهور، ان نقدر نعالج، نمنع قبل ما نعالج، مظبوط؟
صح. يس، هاي أصلاً
ان
وظيفتنا إحنا أخصائيين التغذية. prevent
شاء الله.
أول شيء.
ان شاء الله تعالى.
إن شاء الله.
اللي بيبعتوا تشات بدي اياهم يسالوا.
ما أشوف اللي يكتب.
ايه؟
ما أشوف اللي يكتبون.
ما حد، لا ما حدا بيسال، معناته كلهم ما شاء الله فاهمين الموضوع كله كويس. اخ حميد معنا؟ اخ حميد اسمعنا؟ اسمعنا الوالد؟
بل المفروض معنا بكلمة بتشوف. أوكي.
آه. يعطيك العافيه اخ حميد.
مرحبا أهلين.
وبحب أبارك لك في طيف ما شاء الله عنها، يعني هي كانت
شكرا.
نعتبرها خير سفير لبلادها عنا، وهلا هي سفيرة للأردن عندكم إن شاء الله تعالى.
شكرا دكتور، شكرا.
وهنيك فيها إن شاء الله تعالى، وإن شاء الله تفرح فيها وأبدعت ما شاء الله عنها.
الله يسلمك إن شاء الله.
وإن شاء الله نلتقي فيكم
والتوفيق.
على الخير والمحبة إن
وبالتوفيق
شاء
لها إن
الله
شاء
في
الله
بلدكم
في
الثاني في الأردن إن
مشروعها.
شاء الله. الله يخليك، تسلم إن شاء الله.
الله يسلمك.
والزملاء طيف إن شاء الله بدنا همتكم إن شاء الله بعد العيد، ونتفاعل مع بعض بشكل أحسن إن شاء الله تعالى مواضيعكم. ويعطيكم العافية إن شاء الله.
الله يعافيك دكتور.
يلا مبارك إن شاء الله.
دكتور الحين راح أدخل تيمز أو لا؟ أنت كنت
إيه؟
يعني الحين أنت راح تقول لي شنو قيمتني أو لا؟
قيمتك؟
إيه.
إن شاء الله خير، إن شاء الله خير. معك التقييم من السي للإيه، A بلس A B C. لا توكل على الله. إن شاء الله خير، مبارك إن شاء الله.
يعطيك العافية دكتور.
يلا، وإن شاء الله زملائك إن شاء الله بيبدعوا زيك إن شاء الله تعالى.
إن شاء الله.
يلا يعطيكم العافية.
الله يعافيك.
السلام عليكم.